Hello and welcome to the MiCare Champion Cast. I'm your host, Brian Peters, CEO of the Michigan Health and Hospital Association, and today I'm honored to have my good friend, colleague, and returning podcast guest with me, Tina Freese Decker. Tina is the president and CEO of Corewell Health, leading more than 60,000 of her colleagues within the integrated health system that serves urban, suburban, and rural communities across Michigan. She also oversees Corewell Health's provider-sponsored health plan, Priority Health, which serves over 1.3 million members across the state. Today, we'll learn more about Tina's journey as the 2025 chair of the American Hospital Association Board, which is an incredible honor, and she's doing a phenomenal job in that leadership capacity. And we'll also discuss with Tina what's top of mind in healthcare at both the state and federal level. Tina, thanks so much for being with us today.
Oh, I'm so glad to be here with you today, Brian.
Well, before we jump into our conversation, Tina, we always like to ask our guests a bit about their backstory, and we'd love to hear how you got into healthcare leadership. What led you to this field, and what's inspired you the most about healthcare?
Well, healthcare is so different from every other field out there. It's such a personal field, and we all have needed care or been through a health journey with a loved one before. And most time they're good experiences. Sometimes they could be bad ones. But one that really sticks out to me is when I was taking my grandmother, Tony, to her oncology visit. And she had to go to the doctor visits and chemo treatments during my winter break when I was home from college. And she said, just drive in the parking garage until you see flowers and then drop me off. And I thought, oh my gosh, what is, I know things are confusing to her, but really is that the best thing? And so I drove around and around in the parking garage, and sure enough, in the middle of winter, there are these beautiful flowers next to the door. And I dropped her off, and the oncology clinic was right there. It was very easy to access. And I was so impressed by how the hospital thought of the people that they were caring for, and some of the people that are most vulnerable, because they're going through all the treatments and sometimes very confused because of the medications, and how easy it was to get to the place that they needed to get to. Didn't have to walk far, we're right in. And I thought that's something that I want to make sure we can instill in every healthcare experience, not only for the patients, but also for everyone that provides the care. And so that's what instills in me every day, that to be in healthcare is to help make every day a little bit better for the people that provide the care and that the people are receiving the care. And that's my inspiration as we move forward.
Well, it really does show, Tina, in your leadership, as I've watched you in your capacity as chair of the MHA Board of Trustees just a few years ago. It was always about what can we do and what should we be doing to benefit the patients and communities we serve. And I know you've heard this story many times, but my own Corewell story, of course, involves my family and our daughter, Madeline, who was a patient in the neonatal intensive care unit at DeVos Children's Hospitals some years ago, and just had an amazing experience in every way. And she's alive and well today as a direct result of that. So I can't thank you enough for everything you've done for me and for our family. With that in mind, Tina, you picked quite a year to be the chair of the American Hospital Association Board with everything that's been occurring in D.C., but we'd love to hear more about what that experience has been like from your perspective, and what are some of the most exciting and challenging aspects of chairing such an impactful board?
Well, I've said before, a smooth sea doesn't make a skilled sailor.
Right.
And so we definitely don't have a smooth sea this year. I felt that it's been a very engaging and enlightening year. I don't think anyone could have predicted the year that we would have, especially in the impacts for healthcare. And it's been a year where we've had to really focus on how do we come together as a field and engage in constructive and beneficial dialogue of how we focus on the future. And so I've learned so much. I learned a lot from you, Brian, when I chaired the MHA, and I've learned so much from the AHA. And my goal as I started as chair was to make sure that all of our members felt heard, felt listened to, and felt cared for. And by doing that, one of the most exciting things that I believe we've done is we've engaged in strategy sessions with many CEOs across the country. And we've brought them together almost every month and just had conversations about, what could come up with the new bill. This was prior to the bill being passed. And now that the bill is passed, what do we need to do going forward? And what proactive strategies should we put in place? And so that's where I'm excited, because we're now able to look at some of those proactive strategies. We've had to do some defensive. It's very important to protect and to strengthen our organizations and our hospitals. But we can also look ahead and say, how do we drive healthcare forward to a future that can be more affordable, more exceptional, simpler, in the example of my grandmother, in accessing care, and one that we all want for ourselves, for our families, and for future generations to come.
Well, that's really helpful. My insight when you were the chair of our board at the Michigan Health and Hospital Association, obviously we have a very diverse state, small, large, urban, rural, different ownership types, the whole nine yards. And you did a phenomenal job making sure that everyone had an opportunity to have their voice heard, and that we were acting as an association in a way that created value for all. Now you translate that to the American Hospital Association, and you talk about diversity across 5,000 plus hospitals throughout the United States. What's that diversity like? And as far as the meetings around that board table are one thing, but then in your capacity as chair, I know you're engaged in all sorts of other meetings and intersections with the members and the media and all that. What's that been like, just taking on that next level of diversity, if you will?
Well, I love the diversity, that we all come with different perspectives. And one of the most favorite parts of being on the board for the American Hospital Association is going to our regional policy board meetings that are located in the regions. So for us, it's Region 5 in the Midwest. And I just cherish hearing the perspectives from people, but going to another region, going to a region in the West, going to a region to the East, going to a region to the South, it's different. And so it reminds me that we have to make sure that we're always listening, actively listening, and then coming up with solutions that help all of us move forward. At the end of the day, we're all taking care of people. We're all taking care of our neighbors, and we want what is best for our neighbors. And when we put that at the center, when we put people at the center, we can align around what needs to happen and where we need to go. We may have to approach it in different ways to get it across the finish line, but the important part is that we're taking care of our neighbors, and we need to make sure we always keep that front and center.
Absolutely. Well, with that, why don't we dive into some of the issues of the day? And you referenced the big, beautiful bill, and certainly we're going to grapple with some of the ramifications of that in the years to come. But what other healthcare priorities are top of mind for you in your role as CEO of Corewell Health?
Well, you said it, navigating the OBBBA and working to mitigate the impact that has for our patients and for our health systems is obviously top of mind. And what does that mean for us over the years, because it's a phased-in approach. I think we're also keeping an eye on what will happen in September, whether it's the waivers for telehealth and hospital at home, site neutral provisions, other Medicare-related elements to that. And at the state level, thinking about 340B and maternal and behavioral health. So I think all of those are there. I'd love to make sure that we are focused on opportunities and thinking about things from a proactive way. When I look at the entire country and see what's happening, people are concerned about the cost of healthcare. We need to make sure we are playing a part in that, and understanding how we talk about it, how we reduce the total spend for healthcare, how we reduce unnecessary and duplicative care, and make sure that we're delivering on the value that I know we want to do and that we strive to do every single day in our communities. So I think that's critical. I do think creating partnerships is important. There's no way we can do this alone. We're going to have to reach across the aisle and do partnerships with other organizations that we traditionally haven't done that before. And that will require us to think about opportunities in a different way. And so I'd like for us to see AHA and us as leaders, CEOs, associations, to put together a plan for what does that mean to make sure that we can continue to provide health care for the long term and that it serves the people that we serve every day.
And you really have a unique perspective on this question of affordability by virtue of the fact that you have the provider-sponsored health plan, Priority Health, that you oversee. And so that's got to give you some insight that's maybe a little different from many of your colleagues around the state and around the country.
It does. Having a health plan is tightly connected to a health provider where they're both equal parts of your system balances out what you need to do. And it really helps you put the person that you're caring for, whether it's a member or it's a patient, at the center. And it does highlight the need to have affordability and to reduce the total cost of care. And so there's a lot of projects and initiatives that we've put in place between Priority Health and Corewell Health to drive at that, to make sure that we're providing high quality care, but that we're also doing it in a value-based approach. And I think that's where we need to go. And our consumers are looking for that value. But we also have to do more health literacy discussion, because I don't think our consumers and even our employers understand how is healthcare paid and what are we trying to get at. And so there needs to be education about this process, and then a discussion about what do we really want from healthcare and what are we willing to not have.
That's really helpful. And I've heard you, Tina, talk in multiple settings, including the American Hospital Association Leadership Summit just a few short weeks ago, about the notion that our field should not be afraid to do the hard things, right? And there will be some hard things, some heavy lifts for us in the months and years to come, given this landscape that we're in. And along those lines, I'm curious at your thoughts as you talk with your colleagues there at Corewell, the nuts and bolts of running such a major, diverse health system. You look at the impact of the reconciliation bill and specifically these Medicaid funding reductions that are coming at us, some sooner rather than later, some in terms of the provider tax impact down the road a bit. But how do you grapple with that? I imagine you're starting to think differently about how you deliver care, but what's the impact?
It's a great question, Brian. And I go back to what you said about doing hard things. So our patients do hard things every single day, and we help them do that. And so we are faced with a very difficult bill right now. We're going to be required to make some difficult decisions, but we have the choice to be able to embrace that and move forward. We need to make sure we're disrupting the status quo and challenging conventional wisdom. It's going to be hard, but it's also an opportunity to advance care and improve the lives of our teams and our communities. And so I think we need to embrace that choice of seeking those opportunities and finding a way to do it, but it will require significant change. We will not be able to do it the way we've always been able to do it. We're also going to have to talk about what do we mean by primary care and prevention services. My biggest concern is that people will no longer have health insurance, and if they don't have health insurance, will they access primary care services? And if they don't access primary care services, then will they get the prevention and health that they need, or will we see more cases show up in our ERs or in other settings where it's more costly and challenging to help them when we could have helped them earlier on? So I'd love to figure out, how do we still embrace a preventive type of mindset, and we can do so by being mindful of the cost that occurs, because it's an upfront cost to spend to keep costs down later on. So I think that's a big area that we need to focus on. Otherwise, we're going to have an impact to our ERs, to more charity care, to care that we could have prevented if we had focused on primary care earlier.
Absolutely. And of course, you're alluding to those folks who may lose coverage as a result of the new Medicaid work requirements, but also the expiration of our enhanced premium tax credits at the end of the calendar year if that doesn't get resolved. And, that loss of coverage, I think you're spot on, Tina. We've seen this story in the past prior to the passage of the Affordable Care Act, right, where our emergency rooms were really deluged by folks who didn't have that access to primary care, as you said. And I know Corewell's been very innovative about deploying that primary care and doing that outside the four walls of the hospital as well, which really leads me to this thought about innovation. And I know you're very proud of the innovation that Corewell has been a part of in these recent years under your leadership. But can you talk a bit more about that?
Yeah, I think that the only way forward is to innovate. And there's things we can do from an operational administrative perspective, and there's things we can do in a clinical perspective. So let me just give you a couple of examples from both. One of those is we created an inboxologist for our organization. Now you may say that's a made-up term, and it probably is, but we wanted to make sure we were helping our physicians navigate through all of the messages that are coming through their inbox, because it's just way too much. When I talked to some of our physicians, they said they were nervous because they didn't know what type of messages were in their inbox. And now that we've put an inboxologist in, where they're seeing about 75% of the messages coming through and can answer them within a few minutes to an hour, the physician can now focus on the people that they are seeing in the office or virtually. And they don't have to worry that they're going to miss something. What we've seen in this process is that physicians have felt that they are more present with patients, that they are able to see more patients because they're not worried about navigating through all those manual processes. And we've now added a bridge tool, which helps with the AI and taking of notes. So that has reduced, I think, our pajama time for physicians by almost 2 hours a night. So we're putting processes in place, and boxologists in a bridge, that help us do the work better so we can continue to focus on patient care. Some of the other innovation for clinical care is transforming people's lives. You know, something that probably, Brian, you and I do all the time. We sign our name. We're always given a piece of paper and we have to sign our name on a contract or an invoice, and we take it for granted. And one of our patients wasn't able to sign his name in many, many years due to his essential tremor. And in fact, his signature looked like one of those erratic heart rhythm waves when we first saw it. So he was our first patient when we were doing a new focused ultrasound treatment. And in that new focused ultrasound, it takes the laser and focuses it in, heats it up to, I think, 58 degrees Celsius, which is 136-ish degrees Fahrenheit, and targets the part of the brain that is creating that essential tremor. And after that first treatment, they went in and asked for a signature, and it was amazing to see. You could see all of the letters in his name, and the joy that spread across his face was just unbelievable. And that spread throughout the entire team. So this is innovation that is saving people's lives, is helping them have a quality of life that makes a difference. And it really gives joy back to all of us who, for the people that are providing care, the people who are helping provide that care, that what we do is meaningful, and we need to make sure we're continuing to live our mission to do so.
Yeah, that's such a remarkable story. At the end of the day, that's why we're in this field to begin with, right? Is to transform lives and to make people's lives better. I really love that story, Tina. So thinking about the caliber of individual that you need to recruit and retain there at Corewell Health, and this is true for all of our members, we need to have some really talented and highly skilled individuals on our teams. Can you talk a bit about that relationship with the education community and the pipeline? In other words, we got a lot of folks that are leaving the field just because they're hitting that retirement age. What does it look like from your perspective as the CEO of Corewell, looking at that next generation and how we bring in the talent that we need? And is there anything we can be doing as an association from a public policy perspective to help accelerate that?
Well, from an acceleration that the association can do is talk about healthcare as a field that it's a great field to be in. We hear a lot of statistics out there about healthcare, and they may be true, but there's also so many good things about healthcare. The fact that you can impact somebody's life and have the gratitude to be able to do that. The fact that you can challenge the status quo and make some changes and see a field advance quickly to something different and something better. To be part of that it's not going to happen every time, and to be part of that will be truly rewarding. So I think as an association, we need all the help we can to help people realize that the healthcare field is a vibrant area, that we want talented, smart people to come in and help us transform and embrace the opportunities that are coming forward. I think it is challenging to recruit people because the population continues to decrease, and the population continues to decrease in those that are interested in healthcare, which is why I think it's important that we promote it. There's a lot that we're doing, from apprenticeships to hiring the day of the interview to creating walk-in centers so where we can hire you on the spot. All of those are coming together. What we need people that are passionate about helping other people. Because at the end of the day, it's about that person that is taking the time to be with somebody to help them navigate some of the most scariest times of their lives when they need us in healthcare. And how do we turn that into something positive and keep them going for a high quality of life as they move forward?
Absolutely. And technology, I imagine, can be a force multiplier for Corewell as well, right? I mean, whether it's the deployment of artificial intelligence in some capacity or some sort of technology that helps our caregivers and non-clinical staff do their jobs more effectively, right? Are you seeing that technology deployment accelerate as well?
Yeah, I think that there's a lot of opportunity ahead where I see technology able to augment what is needed for humans. And we need people that can help us with that technology put in place and people to embrace that technology so that they can do their jobs even better. A bridge, like I mentioned, is a great example where our physicians are able to spend the time looking in the patient's eyes while the AI A Bridge tool records it, so they don't have to spend the time looking at a computer. That is amazing to do because then you feel more heard and listened to. And it transcribes it so the physician doesn't need to do that at the end of the day, and so you save time at the end of the day. I think there's more and more technologies like that from efficiency perspective, allowing us to do what we really want to do in the healthcare field instead of take notes, or help us identify where there are issues that a computer is better able to identify, from lab pathology identification to imaging identification. Again, it's an augmentation. We still need a human in the loop for this, but the more we can do that helps us get better at what we need to do and helps us get back to why we really went into healthcare, which is about helping people.
Absolutely. Well, Tina, from your perspective, for our listeners to the podcast today who want to get involved, they want to be helpful in some way, shape, or form, maybe that's getting engaged in the political space to support healthcare. What would your words of wisdom, what would your advice be to our listeners?
We welcome you in. So raise your hand, take the initiative to help. What I'm always looking for is what new ideas do you have? You may see something that we don't see. It may be a blind spot. And so we're always looking for people to say, what about this question? And then for those of us that get those questions, we should make sure that we take a step back and realize someone's just trying to help and be thoughtful about how could we do that differently? How do we do it? So we need more people to be engaged, to be curious, and to accept those curious questions so that we can make the progress and move forward.
Absolutely. Well said. Well, Tina, before we wrap, you have the last word. Anything else that's top of mind for you from your perspective as the Corewell CEO, your perspective as the AHA board chair? We'd love to hear what else is on your mind.
I would say, especially since I'm part of the AHA and the MHA, it's critical that we as leaders for healthcare show up with our teams to talk about what's going on, or whether it's going well or whether it's an area we can work on. And we talk about it with our legislative leaders. We understand the stories of the impact that we have within our communities, and we need to share that with many people, employers, legislative leaders, so that we can get across why it's so important that we can continue to provide this care that we do.
That's terrific. And Tina, I want to thank you once again for all that you've done for our field, really leading the AHA this year, leading the MHA, leading Corewell Health. You've been a phenomenal leader, and we're thrilled to call you one of our own here in Michigan.
Brian, I just want to say thank you to you and your team as well, because we couldn't do what we do without the MHA, without the AHA, and without all of the people within our organizations. It takes a village to do what we do, to take care of people, and we all have our particular roles. You and your team do it fabulously, and we're so grateful for that.
Well, thank you very much. And with that, I'd like to thank our listeners for tuning in and would encourage those who haven't already to subscribe to the podcast across our streaming platforms. You can visit mha.org to learn more. Thank you. Have a great day.